canal is defined as an oblique intermuscular passage in the lower part of the anterior abdominal wall, right? It is an intermuscular passage, oblique intermuscular muscular passage in the lower part of the anterior abdominal wall, situated just above the middle part of the inguinal ligament. ठीक है जी? Its length is about 4 centimeters, that is about 1.5 inches, and it is directed downwards, forwards, and medially. Downwards, forwards, and medially. And it extends from the deep inguinal ring to the superficial inguinal ring. You see, this is the deep inguinal ring, and this one is the superficial inguinal ring. So it extends from the deep inguinal ring to the superficial inguinal ring, and the structures which are passing through it. What does it contains? It contains the spermatic cord in the cases of male, and the round ligament of the uterus if the female. Other than that, you can see the ileal nerve is going to enter into the inguinal canal while running between these muscles. Okay. Now, as far as for the sex differentiation, then what is it that in the males it is a larger, and in females it is narrower or the smaller. Okay. Now, the deep inguinal ring. Deep inguinal ring, it is an oval opening in the fascia transversalis. As you can see, this is in a fascia transversalis, and here this is an opening through which you see the spermatic cord is coming from inside of the cavity and passing through this inguinal canal. Okay? And it is located about 0.5 inch above the mid-inguinal point. You can see this is a pivot tubercle. This is spine. This is a mid-inguinal point, 0.5 inch above the mid-inguinal point, and it is medially related to these vessels. These are the inferior epigastric vessels, which are basically the branch of the external iliac artery. External iliac vessels are here, right? Okay. Now, you can see the margins of this deep inguinal ring, right? When the spermatic cord will pass through this, opening in the fascia transversalis, it will receive the extension from its margins, right? And it is going to form the internal spermatic fascia, right? We have talked about it in detail already. Okay, how the internal spermatic fascia is going to form it. Is it clear, Ji? Or in the case of the females, it is named as the internal covering of the round ligament of the uterus, right? In cases of male, that is the internal spermatic fascia, and in cases of the females, it is called as the internal covering of the round ligament of the uterus. Okay, Ji? I told you before also that in the newborn, that this deep inguinal ring, it is lying directly against the superficial inguinal ring, right? And as a result of the growth, right? This deep inguinal ring, it will move laterally, right? And because the length of the inguinal canal increases, right? Okay. No, the superficial inguinal ring. The superficial inguinal ring told you that is a triangular defect in the external oblique aponeurosis, right? Here you can see this is an external oblique muscle, and here it is going to turn into aponeurosis. And this aponeurosis is also leaning downwards, and this is, as you see, triangular defect in the external oblique aponeurosis, right? And it is located just above and medial to the pubic tubercle. Just above and medial to the pubic tubercle. Okay, this is the location of superficial inguinal ring. Superficial inguinal ring, it is about it's a triangular defect, right? It's a triangular defect, and it is about 1.25 centimeters long. Okay. And here you can see it has the base, and then the two sides. The base is represented, is tied to the baby crest, and its two sides. These are named as the cruras, right? Two sides, and it's or rather the two margins. The lower or lateral margin, right? and upper or medial margin. It is called as the lateral crura or the medial crura respectively, right? And these two cruras, these are here, you can see, they are joined with each other with the help of this, intercrural fibers. Now we'll talk about the walls of the, uh, inguinal canal. So anterior wall of the inguinal canal, here you can see it is formed by the aponeurosis, external oblique aponeurosis, right? And this red fleshy fibers of the internal oblique muscle and the transversus abdominis muscle, right? ठीक है, यहाँ तक बात क्लियर है, कोई प्रॉब्लम तो नहीं है जी?
No, sir.
Okay. Now, and here you can see this anterior wall is strongest against the posterior wall. And you see here the posterior wall, it is contributed by the fascia transversalis. And in the fascia transversalis, we have got what we have got here, the opening. There's a deep opening, right? So, opening of the deep inguinal ring. So this is a weakening basically, because by this opening, the cavity is going to communicate. It's going to, communicate with the exterior, right? So here you can see that this opening is guarded basically anteriorly by this anterior wall, right? Whereas the posterior wall, if you look at the posterior wall, it is, laterally you can see it is formed by the fascia transversalis, and medially it is supported by the two other structures. I just show you. Medially it is supported by the other two structures. Okay, you see here you can see this is another inguinal canal. And this is the area of the deep inguinal ring here, and then this is superficial inguinal ring, and this is these two structures forming the medial aspect of the posterior wall of the inguinal canal, and it is contributed by this conjoined tendon. What is the conjoined tendon, G? The arched fibers.
Abdominis, internus, or transversalis.
Right. So the arched lower fibers of the internal abdominis and the transversus abdominis, they're going to form this conjoined tendon, right? So conjoined tendon, and here the fibers which are extending upwards, these are called as the reflected part of the inguinal ligament, right? So these two strong fibrous bands or ligaments, they are going to give strength to the medial part of the posterior wall of the, you can see this is the medial part and this one is the lateral wall, lateral part of the posterior wall, right? So middle part is contributed by the conjoined tendon and the reflected inguinal ligament, and the lateral wall is contributed by this fascia transversalis, right? So here you can see now the posterior wall is strongest rather than the anterior wall, which is formed by the external aponeurosis, in which we have got this defect. So nature has designed that for each defect, for each opening, there is a guard, right? In the here for the deep inguinal ring, we have got the strong aponeurosis of the external oblique, and then the fallacy fiber of the internal oblique and the transverse abdominis, right? Which are just going to guard this opening. And similarly, this small opening in the external oblique, the superficial inguinal ring, it is guarded posteriorly by the strong wall that is contributed by the conjoined tendon and the reflected part of the inguinal ligament. Is it clear, जी? कोई problem तो नहीं है बच्चे यहाँ पे? Clear है ना? So here you can see that you can say that the posterior wall is strongest. Okay? It is strongest against the weakest part of the anterior wall. Is it or not? Right? You can see this posterior wall, it is strongest against the weakest part of the anterior abdominal wall, whereas the anterior wall is strongest against the weakest part of the posterior wall. Is it clear? Okay. Now, roof. How the superior wall of the roof is formed? Roof is formed by the arched fibers of the internal oblique and the transverse abdominis muscle, right? Ji? And the floor where it lies, basically, this I told you, the grooved upper surface of the medial part of the inguinal ligament is going to form the floor of the inguinal canal. Is it clear, Ji? And here some part is also contributed by this lacunar ligament. ये देखिए थोड़ा सा lacunar ligament क्योंकि आपको पता है, I told you that the medial part of the ligament is that there are certain fibers which goes upwards and backwards, and they are going to attach over the pectin pubis. So the upper surface, upper grooved surface of the medial part of the ligament, along with the medial end of the lacunar ligament. Is it clear, Ji? So it's going to form the floor or the inferior wall of the inguinal canal. Functions I have told you before. क्या function है इसका जी? It is responsible for making a passage for the spermatic cord in the males along or in the females around ligament of now here you can see that this is in this area, right? This inguinal canal is basically what? It is a potential defect. ठीक है? What do you mean? What do you mean by potential defect? It is some that it's it is the potential to develop. ठीक है? ठीक है, एक पोटेंशियल डिफेक्ट है जो कि नॉर्मली इट रिमेन्स क्लोज्ड, राइट? ठीक है, बट हियर देयर कैन अकर द सब एबनॉर्मलिटी. और नॉर्मल एबनॉर्मलिटी क्या हो सकती है? एज यू नो दिस पैसेज इज बेसिकली ट्रांसफरिंग द कंटेंट्स फ्रॉम द इनसाइड द पेल्विक कैविटी टू द एक्सटीरियर इनटू द स्क्रोटम. ऐसे ही है ना जी, स्पर्मेटिक कॉर्ड जो पेल्विक कैविटी के अंदर से आ रही है, it passes through the deep inguinal ring, and then it has to pass from this space, the inguinal canal, and then it is going to enter through the superior inguinal ring into the scrotum. ठीक है ना? Is it clear? So it's a potential defect, but यहाँ पे abdominality क्या develop हो सकती है? Some abdominal viscous, some abdominal loop of the intestines, or the peritoneum, or the fluids of peritoneal fluid in the peritoneum. It can come out of the pelvic cavity and will fill this gap, and it can reach up to the scrotum, right? And that is this protrusion of the abdominal viscous, okay, from the abdominal cavity or the pelvic cavity and coming outside, and this is called as this protrusion called as the herniation. Okay, हम कहते हैं जी hernia. Someone got the problem of hernia. So what is a hernia? It is the abnormal protrusion of the abdominal viscous of the abdominal cavity outside the abdominal wall. Basically, abdominal wall ka part na. We have discussed it. We have defined it like that. It is a defect in the is a passage in the lower part of the anterior abdominal wall. So ये passage किस लिए है? It's going to communicate, right? So this potential defect can lead to the formation of the hernia. Is it clear, जी? कोई problem तो नहीं है. So nature has provided this passage with certain guards so that herniation should not develop, right? So what are those? Number one, the number one the thing the nature has provided with it you can see the obliquity of the passage. Okay, the obliquity of passage. And when इसका क्या purpose होगा जी? Can anybody guess about it? How this obliquity is going to help this process? You see these two openings, they are not lying opposite each other. Okay? And with the, I told you at the time of the birth, these are lying just opposite to each other. Okay? And with the passive time, with the growth, this ring, it will move downwards here, right? So it becomes an oblique passage. Okay? So whenever there is an increased intra-abdominal pressure, okay? So abdominal pressure increase over in any conditions, like we have talked about it already. In conditions when you are going to when someone has got the constipation, right, to defecate forcefully, right, and such is like in the case of parturition. Okay, so any such conditions just may intra-abdominal pressure increase the collection of fluid, right? Now have weight lifting है, जब weight lift करते हैं तो you just form straining, this sort of thing. So increased abdominal pressure will lead जब abdominal pressure बढ़ेगा तो क्या होगा? There will be the approximation of the walls. ठीक है? Anterior wall, it is strongest, right? So it is going to be compressed against this posterior wall, right? Okay. So the increased abdominal pressure will lead to the approximation of the anterior and the posterior walls. And this type of the mechanism, this is called the flap valve mechanism. Okay. Right? It is called as what? It is called as a flap valve mechanism. Okay. Number two, mechanism nature has provided with it that superficial mirroring over here. It is guarded from posteriorly, I told you, by the किन चीजों से होता है जी? Medial part of the posterior wall is found by, हाँ जी, कौन बताएगा? मैंने भी बताया था इससे पहले आपको. I repeat these things once again.
Conjoined tendon and reflected
Conjoined
inguinal
tendon and the, very good, conjoined tendon and the reflected part of the inguinal ligament, right? Similarly, the deep inguinal ring is guarded anteriorly by the, you see here, the fleshy fibers of the internal oblique and the, you know, transverse abdominis muscle. ठीक है? और आगे इसकी ये, you got this external oblique muscle. So deep inguinal is guarded by the anterior wall, and the anterior wall defect is guarded by the posterior wall, right? Okay. Number four is a shutter mechanism. Now, what is the shutter mechanism? You can see the internal oblique muscle. Internal oblique muscle, बेटा क्या क्या बना रहा है? It is going to form the anterior wall, right? उसके जो arched fibers हैं, these are going to form the roof of the inguinal canal, right? And the posterior wall, it is contributed by the conjoined tendon, which is again contributed by the these internal oblique muscle fibers, epineuric fibers, right? So this internal oblique muscle, it is going to form the anterior wall. It is going to contribute the, you know, roof, and also it is going to contribute the posterior wall, right? So when this muscle will contract, it will pull the roof downwards, right? ये जो arching fibers हैं, ये नीचे इसको push करेगा, right? And it is going to join with the floor, right? So this is like, you see, just like a shutter. You see the shutters of the shops, right? You just have to pull the shutter from the upside down. You just make it up the floor and then lock it. Is it or not? So here you can see this internal oblique muscle. It is responsible for the shutter mechanism of the shutter mechanism of, you know, for the closure of the inguinal canal. ठीक है जी? The problem तो नहीं है जी. And in this regard, the transverse abdominal muscle will also help it. Okay. Now, there is another mechanism that is called the ball valve mechanism, and that is basically due to the, as I told you before, that this spermatic cord, it has got three coverings: the external spermatic fascia, which is coming from the external oblique aponeurosis, then the chemostatic muscle or the chemostatic fascia, right, that's coming from the internal oblique, and then the internal spermatic fascia that is coming from the fascia transversalis, right? So the chemostatic muscle, when it will contract, it will plug the, you know, spermatic cord in this superficial inguinal ring. ठीक है? Superficial inguinal ring में आके ये जब उसको, it will pull it up, the, you know, when this muscle will contract, it will it will pull up the, you know, this spermatic cord. So it is going to plug this defect, the triangular defect. Superficial inguinal ring को ये plug up कर देगा. So this is called, it is just like a ball is going to fix at the opening, right? So it is called as a ball valve mechanism. ठीक है बेटे, कोई problem तो नहीं है? Okay. Another mechanism is that in which you see this superficial inguinal ring, it is having the two margins I told you, the lateral crus and the medial crus, right? And when it will contact, what will happen? It is going to, by this intercrural fibers, right? It is just going to, you know, क्या करेगा जी? It will approximate these two walls. ठीक है? जब ये contact करेंगे, ये external भी contact करेगा, तो ये इसके ये जो fibers हैं, lateral crus और medial crus के, they are just going to approximate these two walls, right? And it is called the slit valve mechanism. ठीक है जी? कोई problem तो नहीं है? And one more thing, when there's a, you know, mechanical mechanism also, some sort of a thing. In the straining like conditions, like the defecation or the partition, the thighs are approximated against the abdominal wall. So if this mechanism, it is again responsible, just the closure of this canal, so that the abdominal viscous should not, or the pelvic viscous, they should not, lead to the any sort of the herniation. Is it clear, जी? कोई प्रॉब्लम तो नहीं है बच्चे? ये मैकेनिज्म ऑफ द इंग्विनल कैनाल समझ में आया आपको? राइट? एनी प्रॉब्लम? हेलो?
सर ये वाला दोबारा एक्सप्लेन कर दें.
लास्ट पॉइंट बेटा?
Yes, sir.
I told you that in the conditions like straining, when someone has got the constipation, right? Then for the defecation, of course, the thighs, they are just going to be approximated against the anterior wall, right? Or the parturition also. So in this case, this passage is again closed between the thigh and the anterior abdominal wall. So it is compressed, it is closed, so it would not lead to the passage of the, or lead to the herniation of the meniscus. Okay, now we'll talk about this clinicals of the inguinal canal. The most important one, that is called, of course, the hernia. And hernia, it is defined as the protrusion of any of the abdominal content through any of its wall, right? Generally, when we talk about the herniation, so hernia is a protrusion. I just showed you now. Here you can see the protrusion. This is an anterior abdominal wall, right? It's a region of the umbilicus here, you can see. So the protrusion of any of the abdominal contents through the any of its wall. Anterior abdominal wall से आ सकता है, inguinal canal से आ सकता है, femoral canal से आ सकता है, right? Okay, so when this herniation is going to be formed, it contains of its coverings, right? You can see, right? And it's going to form a sac, which is just coming out of the, or covering में क्या होगा? Covering is basically contributed by what? It is the, first of all, innermost lining कौन सी है जी? That is the peritoneum, right? So you can see this one. So it is contributed by the peritoneum, right? And here see where the opening from which it is coming out, the narrowest part of this, it is called the neck of the hernia, right? And this is called, this expanded part, this is the body of the hernia, right? So protrusion of any of the abdominal contents through any of its wall is called as a hernia. Okay. Now this hernia sac, normally it contains what? If it is a smaller one, sometimes it is only the peritoneal fluid lies in it, right? If it's getting a bit larger, some part of the small intestines, like the ileum, jejunum, whatever, right? They can come in it. Okay? And it's a larger defect of any organ, right? Any part, they can herniate. Okay, so you see, when this hernial sac is formed, it has got neck and a body, right? And there are certain complications associated with it. Normally, you can reduce the patient. He comes to you with the complaint, gee, I got this swelling in this certain part of the abdominal wall, even the inguinal hernia, whatever. So this swelling is like this, that when I just going to push it manually inside, I can reduce it. ठीक है? जब मैं इसको manually push करता हूँ तो ये अंदर चली जाती है और disappear हो जाती है, but when I will leave it, then it will again develop. ठीक है ना? दोबारा intra-abdominal pressure बढ़ेगा तो ये दोबारा बाहर आ जाएगी, right? So reducibility, it is the factor for it, but it's a differentiating feature. ये मतलब swelling जो है ये hernia है, it is something else. So इसकी जो complications हैं, it can occur like this, that it can be irreducible. Irreducible क्यों होगी जी? Yes, the narrow is, the neck is narrower, ठीक है? And the content coming out is larger, ठीक है? तो अगर larger content होगा और वो यहाँ से neck narrow होगी तो you cannot push it back, right? So irreducible हो सकती है. Number 2 क्या हो सकती है बेटा कि it will get obstructed. ठीक है ना? Irreducible है, obstructed है, so that you cannot push it back, right? You cannot push it back, ठीक है? But you see it is, it is still viable, ठीक है? And the third one is the strangulation, and it is gets strangulated sometimes. इसकी जो neck है, it is so narrower that it's the blood supply of the organ coming over here, it is impeded, ठीक है? And then it is having the chance of getting necrosed, ठीक है? The patient comes to you with the pain or complaint of pain, and if you're just going to try to reduce this, he will tell you that if I'm going to reduce this one, I cannot reduce it before. Earlier I can reduce, but now I cannot reduce it manually, and now it is quite painful. So it means that it is going to be strangulated, and this is an emergency, and you have to go for the laparotomy. You have to go for the surgical procedure for that. ठीक है जी? Okay. Now hernias, but basically it is of two types: the external hernias and the internal hernias. The external hernias are basically the one which I've defined it, that is coming out of the anterior abdominal wall through or the other any abdominal wall outside of the cavity, right? And the internal hernias are there, that there are certain inside the cavity. They are the certain places in which the loops of the intestine, they get strangulated. Okay, we'll talk about it in detail, like the internal hernia example, when the intestinal loop, they are basically entered with the epiphytic foramina. What is the epiphytic foramina? We'll talk about it in detail later. Okay, when we talk about the weight hernia. So far you must remember that the external hernias and the internal hernias. External hernias में क्या होता है कि the loops of the abdomen or contents of the abdomen, they are going to come outside the abdominal wall, whereas the internal hernias में क्या होता है कि there are certain no-go areas in the inside the abdominal cavity, right? And the loops are getting stuck in that, right? Okay, when we talk about the hernias, there are certain types of the hernias. ठीक है जी? The umbilical hernia, right? The epigastric hernia in the region of the epigastrium, ठीक है जी? The lateral hernias, you can say, or the para-umbilical hernias कह सकते हैं. The inguinal hernias, its name is representing when you are going to perform any surgery, ठीक है? जब आप सर्जरी परफॉर्म करते हैं तो वहाँ पे you have to cut that one, right? And sometimes the muscles in this region, they are not going to have the proper fibrosis and closure, so that this defect remains, and when there is increased intra-abdominal pressure, तो यहाँ से the herniation develops, right जी? And then the inguinal hernias, of course, in the inguinal canal, I told you, the one we have discussed in detail, the inguinal canal se jo protrusion hoti है, that's the inguinal hernias, and the other one is the femoral hernias, right? And these are located where? Through the femoral canal. Is it clear? जी, problem तो नहीं है, right? So remember one thing, beta, what would the cause of the hernia? The cause of the hernia is always when there is an increased intra-abdominal pressure. ठीक है? Either in the cases of straining, if there is a patient comes with the long history of the constipation, ठीक है? Chronic constipation के साथ हो, chronic cough के साथ हो, right? If he has got the any history of the tumors, ठीक है? The problem is the tumor, right? There is increased you can say जो heavy weight lifters होते हैं, right? ठीक है जी? और या वो लोग जो होते हैं जो लोडिंग का काम करते हैं, ठीक है, जो वेट लिफ्टिंग का काम करते हैं, राइट, वो लोग होते हैं. So or sometimes you see inguinal sort of thing when they have got a history of surgery, and there is a development of the hernia in the area of the incision of that surgery, right? Clear जी? And sometimes you have this something stuck which is आपके पेट में लगती है, you got something hit by your abdomen, hit by something, right? So that can lead to the weakness of the wall. So anything, any cause lead to the weakness of the muscles of the abdominal wall. As far as you see, this is epigastric hernia. So epigastric hernia, but it is, you see, due to the improper feed, ठीक है, ये birth भी हो सकती है, right? So there are a lot of causes. Okay, now we'll talk about the inguinal hernias. Inguinal hernias, I told you, that is a protrusion of the intestinal loop. Okay? It is a protrusion of the intestinal loop through the inguinal canal, right? Okay, now if this, you can see this inguinal hernia, right? And when this protrusion occurs, follow the normal passage that is coming from the, you see the deep inguinal ring passes through the inguinal canal, and then the superficial inguinal ring, it is going to enter into the scrotum. This is called as the indirect inguinal hernia, right? It's called as a indirect inguinal hernia, and it is always present above and medial to the pubic tubercle. Medial tubercle से above or medial swelling. ठीक है जी? Whereas in the femoral hernia, as you can see, this is the defect present in the femoral, that you see the protrusion of the abdominal content through the femoral canal. ठीक है? Femoral canal पढ़ी थी ना आपने जी? And you see
Yes, sir.
femoral hernia, it is most common in the females because of wider femoral canal and the small blood vessels. ठीक है? And इसके जो differentiation feature है बेटा, ये is a viva question. How can you differentiate these two swelling जी? कि inguinal hernia कौन सा है, femoral hernia कौन सा है? Inguinal hernia is always above and medial to the pubic tubercle, and it is always below and lateral to the pubic tubercle. Is it clear जी? Femoral hernia is below and lateral to the pubic tubercle, whereas the inguinal hernia is above and medial to the pubic tubercle. Okay, now there is another type of the inguinal hernia, that is a direct inguinal hernia. ठीक है जी? Here you can see indirect inguinal hernia here, and this one is a direct inguinal hernia, right? And this direct inguinal hernia, it occurs. Show you. Just show you. Okay, so direct inguinal hernia, when the protrusion occurs through the posterior wall of the inguinal canal. ठीक है जी? Posterior wall medially किससे बनती है जी? Posterior wall में क्या होता है बेटा? Fascia transversalis है, ठीक है?
Yes, sir.
Now, this occurs through the posterior wall of the inguinal canal, okay, at the region of the triangle of Hasselbalch. The triangle of Hasselbalch, it is formed limited laterally by the, here you can see, the inferior epigastric vessels, medially by the lateral border of the rectus abdominis muscle, and inferiorly, this is the inguinal ligament, right? So, the direct inguinal hernia comes when it passes at this, Hasselbalch triangle. When the protrusion occurs through the posterior wall of inguinal canal at the area of the Hasselbalch triangle. Here you can see this. And this Hasselbalch triangle, this is a viva question. Normally, examiners, they used to ask that what is the, location of the development of the direct inguinal hernia? What is Hasselbalch triangle? What are the boundaries of the Hasselbalch triangle? So here you can see that the inferior epigastric vessels forming its lateral aspect, lateral wall, and middle is limited by the lateral border of the rectus abdominis muscle, and inferiorly the inguinal ligament, right? So this is the location of the direct inguinal hernia. ठीक है? And the and it is how that as a best triangle is going to be formed, right? So hernias में मैंने आपको बता दिया बेटा इसमें कितने टाइप्स होते हैं जी umbilical hernias होते हैं, we have got the paraumbilical hernias, we have got the femoral hernias, ठीक है, then we have got the inguinal hernias or epigastric hernias, right, inguinal hernias, and there is one more thing that is called as a lumbar hernia. Lumbar hernia is basically the protrusion of the abdominal contents from the lumbar triangle. ठीक है जी, lumbar triangle किसी को याद है जी?
सर वो जो फेमोरल ट्रायंगल था
Lumbar triangle.
वो पीछे जो होता था उसके
Okay, this one, the lumbar triangle, right? Here you can see it's formed by the iliac crest inferiorly from here,